I'm here today joined by Dr. Roya Zandparsa, an expert in AI technology, also a prosthodontist and a fellow colleague whom I've known for a number of years. Roya, thank you so much for joining me.
Thank you for having me.
So Roya, this is an exciting topic. All dentists out there are interested in learning more about AI and machine learning in dentistry. So why don't you share the area that you know a lot about and some of the areas that are upcoming and what's coming up in AI and machine learning as far as the average general dentist and prosthodontist and other restorative dentists out there need to know.
Thank you. Before we get there, I'd like to step back and give you a little bit information about the evolution and what it took us to get where we are now with artificial intelligence. So in 1950, Alan Turing, mathematician, came up with the first computer that was basically had the concept of algorithm. He passed away a few years later, and he was way ahead of his time. And unfortunately, he never really got to see it. But he became the father of theoretical computer science and AI. A few years later, in 1956, in a famous conference, Dartmouth conference, a few people like John McCarty, Marvin McKenzie, Alan Noel, and Herbert Simon came up with the idea of artificial intelligence becoming a field. And since then, it's just so many others came and took a part in AI, in healthcare, and in different areas. AI, artificial intelligence, machine learning, and deep learning gets confusing sometimes, and people use them interchangeably. You have to think about AI as being a broader umbrella, and machine learning and deep learning within that is under that. So artificial intelligence, it's mimic the brain, and you could make machines, intelligent machine, that they could perform human tasks, even sometimes more efficiently, right? So MI would be exactly part of or subset of artificial intelligence. It's the simplest definition would be that the computers have the ability to learn and train through algorithms, right? So think of a baby that you have to feed it, especially on an early stage, with a lot of stuff, a lot of data in this case, and then they would be doing their own task. When it comes to deep learning, the deep learning is a subset of machine learning, and basically it's ability of the machine to learn itself. And it could perform complex and complicated tasks, and it does that by processing multi-layer networks of data. So it gets more complicated. That's nowadays a lot of people are working on that area. AI, they have many applications, as we know, not only in agriculture, in internet, when it comes to, for example, digital marketing, and in traveling, in medicine, in healthcare, dentistry now, and in so many different areas in business, So AI is around us. And you might observe, like it's many times that you watch Netflix, you watch movie, and you like Pandora or any of that, Spotify, based on your interest, based on your behavior, and based on your choices, it gives you recommendations about the movie, about the song, that you may not ever notice those, right? Another product would be Nest. If anybody of some of the audience might have it in their home, based on your behavior, the thermostat gets adjusted, it turns off, it saves energy for you, and there are many other applications or many other areas in business and around us that they use artificial intelligence to improve customer service experience through our behavior. The drones nowadays drop off product and goods for delivery purposes, but they have been also used for news reporting and also for video making and all that. Alexa or Siri, these are our assistant, virtual assistant that they give us information about the weather, about the traffic, and you could ask questions and so on. Application of artificial intelligence in healthcare and medicine, it's broad. It could be from drug development to surgical or procedures to scheduling patients, checking follow-up appointment, digital record. When patient takes different medication, it could show them the adverse effect of multi-medication that they're taking, and immunization record and all that. So it has a vast application in healthcare that we use. Today's operating room and staff, they are overwhelmed with the amount of the data and the redundant task that they have to do when it comes to operating room. So in these cases, the important thing is that with use of AI, you could eliminate this manual interaction by automation of AI-driven AI, and that would replaces that to optimize the OR workflow. It makes it easier for the staff to communicate via that, and actually with the doctors as well, and it just makes it to have a better workflow when you are, or they're working at the OR. In learning into institution, mixed reality, that would be artificial intelligence, augmented reality, and virtual reality plays an important role. We have been switching or changing or replacing the live patients with virtual patient for a learning purpose. And think of if you are in an operating room and the doctor could superimpose the patient's anatomy prior to the surgery or during the surgery to help him to diagnose or assess better, or if they could just have the hologram of the anatomy of the patient right with the fingertip in front of them so could assess it, that would create a really great tools for them to perform better and deliver much better care for the patients. Through robots, also artificial intelligence can perform precisely and also accurate procedures that sometimes it might be difficult for doctors to do. There is ROSA 1. There is these robots that they perform surgery on the brain, on spine and knee. I give you example like for epilepsy. The procedures, it's very complicated and very tedious. It takes hours to be performed because of the not having enough access, and it's a little bit complicated when it comes to that. But with robots, fortunately, it eliminates that, and it makes it to be much quicker, faster, and better result at the end. There are 6 million robotic surgery that gets performed, every year. Some of those is from scanning, incising, getting into the bone, brain, heart, and different segment to just perform surgery. But it just has been recently that robot dentists, they have the dexterity to start rooting around the patient's mouth, and they're be comfortable with that. The Yumi, it's a robotic that we use in dentistry, becomes gaining more popularity. And based on the company claim, a full arch implant placement could happen in 90 minutes, and a dual arch could be in 2.5 hours. So it's a flapless surgery, and we all know that when it's flapless, so you have less complication, it's less invasive, but also it's more speedy recovery and easier recovery and less pain. There are 30% of caries and pathology and anomaly gets missed. It's a huge number. It's almost 1/3 that goes undiagnosed. So there are different software with the AI power dentistry tools. They could actually help us to detect these caries. So we could use that as a detection tool, not only, as you see here, to detect pathology, anomalies, but also caries, It could help us to do a self-analysis, something that would be routine in orthodontic offices. And you 42 landmark that you have to pick and you have to trace, it could be done in a few minutes. AI could be used to evaluate the maturation stages. It's really important when you, for example, place an implant and you have a patient that, like a 16, 17 years old, and you're not really sure if they are mature enough and if the growth has been completed. So it's another additional tool that could help you with identifying that, recognizing that, and it would optimize the timing for treatment and procedures. AI-powered dentistry tool also build trust with patients through second opinion. This is through Pearl, the company, and the beauty of this is that you could have reliable and instantly you could have detection of the pathology. This is based on the computer vision platform, and it's a deep learning. And utilizing this tool, it gives the patient a peace of mind, and also it builds up a great trust between the dentist and patient, because the patient could see what's going on, and that would be like an awareness for them. Also, you could have the practice intelligent, practice management with AI, with artificial intelligent help. You could drill into the data from your practice, and you could get a lot of information to not only help with the outcome of your clinical and patient care, but our financial outcome and your return of investment. It could help you with marketing. It could help you with training your staff, hiring, firing. Let's talk about if you decided to purchase a practice. It could give you a whole idea of what's going on, a great picture of what's happening in that practice. So it's a great tool, but also it gives you a smart margin. Before you send the case to the lab, it could detect the margin, it could draw the margin for you. That would be a great tool for you to save time, and also for the technician, instead of sending the case to the lab and not being able to detect it and not have to basically retake the impression, all that, it could eliminate all those steps. And another advantages would be for claim reviews. When you send in the claims to the insurance, this could remove some of the liability. You could, based on the insurance, what they preferred for them to be sent along with the claim, you could double check that. So it's a great tool when it comes to that. And I know many insurance companies, they also use these tools, right? And also for DSO or for big, large practicer, or for someone that have multiple practices, they could use it as an auditing, to make sure that everybody's on the same page, everybody's basically by the book and performing the best treatment that they could for patients. Another advantage of the AI, it would be with use of either 2D or 3D CBCT, you could look at and measure the airway volume. And if you use other tool like a CBCT, and you could plan and manufacture like a sleep apnea appliances directly through that. If you have a printer in your office, or you could send it to the lab and they could print you the appliances that it would be custom made for the patient. You could track nerve when you place in implants, and you could look at the position. You have a library of the implant that you could choose. You are able to plan your implant placement from the start to finish. You could track the jaw movement. You could measure the condylar inclination and all those numbers, and you could punch it into the digital articulator. As an endodontics, you would appreciate this, that you could basically, it would help you with the size of the canal and the length and all that, and the shape of the canals. So if it's calcified or if it's narrow, you could, with the use of CBCT, you could fabricate and make this 3D drill guide that would be eliminate or reduce the amount of perforation. For procedures, precision planning, and for accurate and predictable result when it comes to implant, this is an open system. Many of these systems are open system. That's what I go with if you have a choice. And because you could choose any intraoral scanner to take your impression, you have the CBCT, you could merge them, and you could choose from the library of the implant and abutments. So from start to finish, from placing to restoring, you could do all that seamlessly by integration of all this technology. And another beauty is that you send it to a CAM with the manufacturing part of that. You could fabricate your surgical stand and you could just place the implant. You also have the app. You could download it on your smartphone, and you could communicate that with your colleagues, with your team. And if you're doing a multidisciplinary cases, this is actually a very secure and HIPAA compliant portal that you could use and utilize. The other advantages of the AI, and I think this is a silver lining of what we've been dealing with this pandemic and COVID, that's the telemedicine and teledentistry, to be able to engage and communicate with patients remotely and help them to either diagnose or treat any problem. And also there are oral health tracking apps that the patient could utilize, and the dentist could use that to get to know the patients better, a little bit of the history, because the patient could take pictures with their mobile device, and that if they have problem, they can communicate with the nearby dentist. But also the interesting things about this application or apps are that it's educational. So if you have questions regarding anything, you could ask the question, and it actually has quizzes. So it quizzes you on that to evaluate the degree or the level of your knowledge. When it comes to toothbrushes, there are smart toothbrushes available. Different companies make them. There are a little bit of those tiny sensors that embedded into the brush and could detect plaque and could give you recommendation of the technique of your brushing and how you do. There is another great technology that the dentists plan the treatment. They come up with this protocol. The tool makes that into a chart, and there is a scan box that gets delivered to the patient, and the patient takes a bunch of pictures, and that goes to the AI power section, and that developed based on the treatment plan that the dentist had. Some communication and recommendations to the dentist. Dentists would audit that, look at those recommendations, and they could easily, via the same path, they could communicate with patients. So this is very good when it comes to ortho, and a lot of times that you cannot really see the patient on a regular basis, or patient might not want it to come in. So it establishes a good relationship between a doctor and patients remotely. There are many cutting-edge technologies out there, and the beauty is to how you would get those technology integrated and use it. For example, the face scanning, that you could have the facial image and you could superimpose that into the CBCT or X-ray, and that gives you how the patient improves over time. From implant planning to, you can look at the bone, you could look at the vital or critical anatomical structures. You can look at the patient, how they improve if you're doing, for example, ortho treatment over time with the facial expression. So you can superimpose tissue over bone and all that. So it just gives you vast options, of basically how to integrate all this technology and take advantage to elevate the clinical, knowledge and clinical care for your patients. There are also these cool glasses that you could wear, and when you use the intraoral scanners to take digital impressions, sometimes as a dentist it's frustrating because you have to constantly turn your face to look at the monitor, scanner monitor, but these glasses, they have been augmented, so you basically, when you're looking at them, you could see the screen and you don't have to look back at your monitor to check the scanning process. The other cool things about them, some of them, not all, they equipped with the AI technology, and the patient has this pad command that they can they could easily communicate with the dentist, in different languages using the voice recognition and using all the technology. And that's by itself, it's amazing. But also the dentist could use that as a marketing tool or entertainment for patients if they get bored at the dental chair. So there's a lot of other applications. I think we all get frustrated when it comes to periocharting. I remember my hygienist used to scream and just always asking assistant to go and help her to punch in the numbers in the computer. So now with the voice recognition, and there are, actually Dentrix just came up with the perio voice too, and there are different tools that they use that technology to have the voice control periodontal charting. The other advantage of that is that it is live. You could engage patients into the charting process, so they could hear what's going on, and the machine basically, it would tell you, it alert you, just say, oh, if it's a 4 millimeters pocket or 5 millimeter pocket, that would just say warning. It's very helpful to engage patient and communicate with them later on about the issues that they have, and did they be part of the treatment. I'm going to end my presentation here with this, that Columbia, it's a pioneer, and Columbia University, they came up with the Center for Precision Medicine, Dental Medicine. They partnered with Plameca, and they have these radio frequency identification tags that are placed on all the instrument and the tools and everything, and even on your faculty and student badges. And the chair is actually, it's becoming in turn into a collecting hub for data collecting hub. So using all that, you're constantly collecting data, and you could diagnose chronic diseases from the early on when the patient walks in, and you could identify a stress level of the patients. You could actually, the faculty could use, because it has two different cameras, different angle, they could see what instrument the student picking, what they start with. So there is a lot of information, and there is a lot of data there that we could use, and hopefully this is a dream, but that it's coming true, that we could individualize medicine and for our patient, and that would be evidence based with the relationship or correlation that we all want between the oral health and overall health. So this technology is amazing, and I just wanted to thank you for having me here and letting me share some of the, this, artificial intelligence application with the audience.
Well, right, this really sums up the big picture view of what is needed and what people need to know about AI. It's pretty clear to me that things are moving in that direction. The combination of AI, machine learning, deep learning, as well as big data, coming together with this ability to manage this information and then input it into computers so that we can get a lot more information with pattern recognition software in terms of making all of these and 3D imaging, all of this stuff. It seems like digital dentistry is here. This is maybe the beginning of the end of the old way of doing dentistry. But one area, Roy, that I think is really important and significant, because I've seen that on the side of being involved with medical devices over the past 30 years, even though we've had so many advances in devices in the past 30 years when it comes to, at least to endodontics, the principles of care have not changed. Those foundational principles for success have remained the same. We may still be able to scan in an impression and send it out to the lab, but if your prep is not proper, and if you haven't done the right markings, you're probably not going to be able to get a good crown still. So how quickly do you think, because obviously when it comes to computational science and technology, there's a couple of different factors. One is the rate at which we are going to get improvements, which is, with the chip speeds, and as well as the software that accompanies that, right? Because it takes time to obviously program all of these things. And then the learning bottleneck, right? With dentists, especially some of us in the older generation. I mean, not you, I'm not putting you in my, but people like me that have in the, it's just kind of getting on with the newer technology and the computer savviness that it requires. Where do you think this is as when it comes to dentistry in terms of the rate of acceptance? At what rate is this coming in, and at what rate dentists are going to be able to implement it clinically?
Great question. So I would just say, I'm just going to give you, and I know you know that. Remember when the sensor, the digital, imaging just came around, and a lot of people just say, why, it's too expensive. Oh, I'll have to change everything. And you get comfortable with, like, I just, I joke, but it's just a 35 cents, film versus like you spend like several $1,000s on, equipment and all that. Now you have to train the staff. With the practice management software, the same way. You were very comfortable just writing your notes in the chart, bringing the chart on. So it took a long time for all dentists to realize the importance of it, and then it's actually elevates so much time from the staff and for the dentist, and makes it to be easier for communication and transferring x-ray and all that between different practices. So the application of AI, I would also give you another example when we talk about guided surgery with implant, right? Yes, I could, and I did many times, I place implant with just a pre-apical x-ray, right? But now just like you need to have CBCT, you need to have a surgical stent, and it has to be guided surgery. So we save a lot of time, we cut the cost, we spend more time face-to-face with patient, and we focus on more complicated and difficult cases. So this is like it's coming. The acceptance might not be so quickly like we have observed, and I know everybody has a different learning curve, and everybody has a different acceptance level when it comes to new technology. But as you said it's here. It's already here, and it's going to stay. So it would be, I think it's going to come times in like a few years, maybe even shorter, that you wanted to look at the x-ray in a different way with detection. So, as I said, there are many pathology caries that get undetected. I mean, I feel like, I've been one of those, and I don't know about you, but, many times at the end of the day, you get tired, your eyes get tired, you're a human being. It's a fatigue that kicks in. And you might not look at the x-ray the same way that you were looking in the morning sharp when you were just at your office. So it would become a standard of care to actually look at the x-ray with detection, right, using the AI and this computer vision platform and softwares. When it comes to your practice management, I tell dentists, I just said many times, we spend so much money on marketing, and we wanted to just adapt on this different way of bringing new patients to our office, but we don't realize how many patients in our office, existing patients, that basically there are many areas that we have not picked up what they need. But so by utilizing AI, we could basically drill into the data, and you could look at that would be very time consuming and for a staff to do, but the machine, they don't get tired, they just, they don't have the fatigue, they are consistent, and you could rely on them, and it's unbiased, in other words. So you could get more, work done, and you could increase your return of investment by your existing patient that is there. So I think when general public, they would understand the importance of that, and they would see it. I think artificial intelligence, they have an easy way to get into dentistry than a hospital or like a medical field, because it's easier. The dentist goes to the, some of these conferences, they see the application, and we are entrepreneur at the end of the day. We are running our own business, and you could just purchase those and make the application. The good things about many of these artificial intelligence tools is that they are very friendly, and they work and integrate easily with the existing or most popular practice management softwares. And in Europe, I think they're already using it, that, the x-ray, your sensor is already equipped with detection. And I know for a fact the iTero, the scanner, intraoral scanner, the new version, the Plus series, they have the AI chip already in them. So they are basically predicting, and they know this is happening, Right. It's already happening. It's just to what extent it's going to be, implemented, and how dentists would quickly adapt and they use it in everyday practice.
Yeah, that's definitely exciting. And one thing that seems to be interesting to me is that perhaps all of this is going to, as you said, increase the consistency and reliability of the information and diagnosis that we arrive at. Because obviously, if you are going to have a AI system tell you about a diagnostic point, because the algorithm that goes into it has to be something that we all agree on. So maybe this essence of achieving some form of objectivity in terms of our diagnosis and will be helpful in that sense, that we're going to get to a point in which we're going to agree at this point you need to do the work, at this point you can monitor it, and that's something that right now is very subjective and dependent on the operator.
Actually, I wanted to say that the dental treatment is objective.
Exactly.
It's, and you might have faced that. Many times patients come to you for second opinion because, I'm just saying that they don't trust the provider or the original dentist, but they're just confused. A lot of times you could breach that gap, and it adds another layer, trust, between the patient, especially with the new patients, with the dentist. Because if you have it there and your staff could even see it, say you have patients that you did not notice that they have a tooth that has a preapical lesion or caries, and you picked it up with the detection, right, with the AI, and your staff could bring it to your attention while you're seeing that patient for follow-up exam, and you could just have that discussion. There has been a survey done that actually patients really like AI and the technology because they feel that it's unbiased and it's a machine that telling them this is I gather based on all this data that I'm observing. But at the end, it's that the dentist, it's the authority, it's the dentist. The dentist, have the commodity, and also we are the quarterback. At the end of the day, we are commander of chief and making the final decision of what we're going to go by. That because some of this software, they could make you a report. You could even show it to the patients, right? If there is a bone loss, if there is any issue, that you could bring it to their attention. So yes, that would gap the bridge between and better the connection between the dentist and patient when it comes to trust. It's unbiased, it's reliable, it's instant, and so it could really add a lot of
objectivity and also some credibility to the profession as a whole, because you end up having a immediate second opinion as well, and I think that's where it's going to end up being very helpful, as you mentioned about second opinion.
I always said, think about this, how wonderful it is to have a colleague that you trust, or assistant that you trust, watching over your shoulder, telling you like a doc, look at that tooth. I mean, I think there is a pathology there, there is a lesion there that you should look at, and that assistant or colleague never gets tired. When you're dealing with huge data, and when it comes to area that it's like you can really manage it, workforce, if you don't have enough staff, this is a great tool to have to help you. So think of it as a great addition, great help, great assistant, that it's going to be with you. And even if you're not at the office, you could start like you could function and work and help you to increase not only the productivity of the financially, but also raise the clinical, or elevate the clinical care for you and for the patient.
Well, this is a discussion that I think we could still go on for another 2 hours on it, but we unfortunately we're going to cut this a little bit shorter so that we don't end up with a very long video. But Paul, we definitely will have you back so we can talk about some of these areas and more detail in a specific area. And if anyone's interested in more detail in a specific area, not only can you get in touch with Dr. Zandparsa directly, I'll probably write down our contact information below here, but also you can maybe comment below, and then we can maybe do another video in one area in more detail, because I know you have a lot of information, a lot of knowledge in this area, and I'm sure our audience would really appreciate you sharing it with them. So, Dr. Zandparsa, thank you so much for this. We're all looking forward to the future. I think it's going to be an exciting time.
It is an exciting one.
A lot of things happening in terms of change for sure is going to come. So I think those people that are going to be more amenable to change, improving, and becoming better and learning and growing are probably going to excel. I'll look forward to the future. It's not going to be Jetsons yet, but sure sure, hopefully enough, it'll be
Slowly but surely would happen.
slowly but surely we'll be coming in our jetpack and do our root canals and get out of there.
Right. I just wanted to thank you for having me today, and I want to just, as a last message to the audience, please get on board, and you want to be part of this. This is a great transformation, and the sooner you get on board, the better it is, not only for you, but also for your patient and for your staff. Thank you, and have a wonderful day.
And thank you. Joined today with Dr. Roya Zandparsa, prosthodontist and an expert in the area of AI technology. Once again, thanks so much for joining me.
Thank you for having me.
For Vivo Dendo, I'm Ali Nase, and let's save some teeth.